The cooperation between the Ministry of Health and GIZ expands to the cooperation with the German government and Sierra Leone government. And after the Ebola crisis, a delegation was sent to the ministry from GIZ from Germany, and Dr. Vaughan and his team, they promised to help in the President's recovery plan. So I think this workshop is a follow-up to what the German government through GIZ promised to help in the President's Ebola recovery program.
The project is called Strengthening Health Systems and also Prevention of Epidemics. So what they did was to invite us as a country to see what are some of our needs, areas that we feel needs to be addressed in area of priority. And we looked at 3 critical areas of work, and that is human resource development. We also looked at financing in the health sector, and then cross-border support.
Of course, the GIZ is working a little bit different because we are working on long-term programs. We are not a funding agency, we are implementing. So we have advisors on each level of the system. On the micro level, it's a development worker. At the meso part, we have other advisors, and also at the political level, and that the messages go from top down and from the down up. So, and my wish is really that it is a start, that everybody understands how the GIZ is functioning.
The partnership approach, which I see in the workshop, coming here with the councillors, coming here with the civil society people, coming here with hospital medical superintendents, brings the important to the fore that health, well, body we say in Creole here, is everybody's business, and but particularly disease prevention, right, is everybody's business. So if you are planning and you come with all the relevant stakeholders, not many but the key ones, it's very important, and I think that is a hallmark of this workshop.
We were able to develop a work plan during that workshop, and of course what is critical here is that GIZ have deployed a development worker in both schools. So with Jessica here with us, and with the other support that we'll be receiving from GIZ, I want to believe that midwifery education in Sierra Leone will move to another level.
At first, I cannot sit there and know what exactly is going in terms of the midwifery schools, in terms of the cross-border activities. But because of, as a result of GIZ creating this platform for us, we're able to see what is happening there in terms of disease prevention and control. Also in terms of the midwifery, how is it progress, how many students are coming. I think things like this is what we should aim at. And even one of the recommendations that we have, that we should have a health platform, a kind of dialogue where other ministries or key representatives will be invited and we'll discuss on health. Because as I said, health is not a one-man show. All of us put hands together and we'll find one unified solution.
Going back a short period of history, we had Ebola through Kailan. So the main goal is that after the workshop, we will be able to have a project that will pilot in these districts such that in the long run, most immediate and in the long run, the results we will get will make the district resilient to disease mobility. So when diseases come in, we are able to detect them, nip them, treat them where they are, and it will have no effect on other districts or other adjacent communities. Working on surveillance is a good opportunity to actually link other units For example, when we talk about cross-border events and activities, this is done with other units like the environmental health units. This is done with other partners like IOM. This is done with partners like WHO, the council, the traditional healers, and so it brings on board many other health-related issues.
The collaboration with the EOC, the Emergency Operations Center, we were working very close during this crisis of mudslide, and it was very important for our partner and also for us that we come together, and we developed, we trained 400 community workers, and we did the follow-up, and I think our partners, they really appreciated it.
You know, when we think about mudslide, the flooding, we are thinking about the outcome of it is cholera. So we are helping them, talking to them, for them not to get the cholera, the outbreak of cholera. So we are sensitizing them to practice the health, practice what they're supposed to do. Didn't have single case of cholera, the entire Australian. We, the CHW, pass on the message, we tell the people what they're supposed to do, and they did it, and they do it. Seriously, we did our best, really.
We've worked with quite a lot of partners, but I see that with Claire's leadership, she's able to consult us and make sure that at the end of the day, we are the ones that are leading our response. We say what we want, and that is what we actually want all partners to do. We would say what we want, and then we agree. You know, you can make your input, but allow us to lead, and that's exactly what we are seeing here, that they are allowing us to make sure that we say, okay, this is the way we want to go. And so at the end of the day, we all agree and go forward and do it, which will end up with a success. And more importantly, we want sustainability. So at the end of the day, we should have something that even when the project would have ended in 2019, the things that we are putting in place will still continue into the future.
So one thing that I'm very happy is the enthusiasm from the participants, because that tells you how happy we're here as a government and as a ministry to work with GIZ to implement this project. Everybody's committed. They found out that throughout the period they stayed to hands-on work on the project, and which is very good. That's a sign that the government and the Ministry of Health and Sanitation is ready to embrace GIZ.